All right, good afternoon, everybody. I'm here with Josh Jabal, our Chief Operating Officer. We're confronted with two storms today, and one's an old-fashioned storm, wind and rain. And just quick update, there are about 40,000 folks without electricity, mainly in the Eversource area. It's sort of spread around Westport, Plainfield, New Milford, and you can go to my Twitter handle at @GovNedLamont, and you'll be able to get all the information in terms of when your community looks like they may get their power back on time. But, shout out in these really tough times for these utility folks who are out there on the ground in the pouring rain doing whatever they can to help get the power back up. Thanks, guys. Let me give you a quick update again on our COVID daily summary. We haven't done this in a few days. Just very quickly, you see the numbers are jumping around a little bit, but the positive cases are up from yesterday, and that's because the tests are up from yesterday. Nothing striking there. The deaths are down a little bit, thankfully, but not a trend makes. I think the most hopeful thing that I see as you look at these numbers, again, is the hospitalization is not going up exponentially, which means our hospitals have a better chance to keep this under control. Again, you can see that while the hospitalizations are not going down, they're not going up faster, and I got to give a shout out. We've got the ventilators, we're keeping up with the PPE, we've got the beds, so we're able to manage this thanks to our amazing hospitals working together as one big system, being able to take care of folks in need. Next up. This is a chart that we've done a few times before. I think it says a couple of things. One, the top line there is Fairfield County. While Fairfield County went up a little bit in the last day, that's in part because Bridgeport has a big surge in infections and hospitalizations. Overall, you can see the line Fairfield County, which is where the pandemic hit first in Connecticut, is flattening out a little bit. Don't get too casual. You'll see that New Haven is still going up, but they have good capacity there, Yale New Haven Hospital. So we're well taken care of there. And Hartford still continues to go up in a consistent way, but not an exponential way. I want to spend a little more time on this chart if I could. I just think it's relevant, especially given the fact that we just announced a partnership with most of our regional governors here in the Northeast, including New York and Andrew Cuomo and Phil Murphy in New Jersey. And you say, why do you need this partnership? Because we worked together when it came to how we were going to slowly close things down and do everything we could with social distancing to limit the spread of the virus. And so far, it looks like that social distancing is working. And it also makes sense if Cuomo is going to open his bars and restaurants at some point indeterminate in the future, we should probably be on the same path as New York and vice versa, I might say. That said, I understand that, look, all parts of the state in this region are very different, and we're going to act on our own. And that's what this chart tells you a little bit. It shows you that Connecticut, our statewide infection, is about 1/3 what it is in the New York City area, and about 1/2 of what it is in New Jersey. So as we put together our partnership, we've got a new advisory group I'm about to announce. This gives you some indication of how we think about these different regions. Again, you can see that Fairfield County is maybe half of what New York is, and then New Haven and Hartford a little bit less accordingly. I think New Haven and Hartford less than Fairfield because we did the social distancing earlier there, relatively speaking. I'd like to think that is catching on. And secondly, it's just worth thinking about Fairfield County, New Haven, and Hartford County, all part of that I-95 Metro North corridor. And that's the other reason that I got together with my fellow governors, because we all share the same tri-state workforce. And we had Phil Murphy from New Jersey on the line, and all of his infections are in the greater New York City area as well. And for Cuomo, they're all moving out in the Long Island. So what we're all trying to do is celebrate the fact that our social distancing is maybe beginning to work. Let's say we're a week or so behind New York in terms of the effects of that, but it also meant we are a week or so ahead of New York in getting our social distancing in place. And that also means that we have a better opportunity to make a difference in the future. I'd just like to say, maybe go back to that last graph if you could. What we're trying to do is deal with the public health crisis that is ongoing and continuing. I think you could see that from the lines as they continue to go up. At the same time, we think about the future, and we think about getting our state back to work in a thoughtful way that keeps us safe. And I am cautious when I say that because I see what's going on in Singapore and Hong Kong and Japan. We've been able to learn first time around when they first got into that, and now second time around is maybe they pulled back a little bit on the social distancing too soon, and you'll see the rate of infections going up in those same Asian countries where they were a few months ahead of us early on. You'll see that in Singapore, for example, infections are up 50%, and they've had to put in place much stricter social distancing a second time around. And that's no good for us. That's no good for the economy. That's no good for giving people hope. That's no good for getting this economy going again. You know, I think we went down and we're going to steadily go back up. But what I don't want to do is down and back up and then down again. And that's what I was talking about with my fellow governors. We think about a thoughtful way that we go about getting our state back to work. Look, I can tell you that you can see, if you remember from some of the other charts, that New London County and Litchfield County and Tolland, are much lower in terms of infection rate. And that's no reason to get complacent. That means that if we continue to go with our molecular testing, the testing that determines whether or not you're afflicted with COVID, we can get you quarantined and make sure the infection does not expand throughout those counties. We can do a much better job of keeping the infection rate low and allowing people to get back to work sooner. And it could be that in a place like Fairfield County, where the infection rate is not nearly what it is in, say, New York City, but is still dramatically higher than it is in the rest of the state, that there we'll focus on the antibody testing. That's the blood test. That's the test that says whether or not you've been infected by COVID and whether or not you maybe built up some of the antibodies that would mean you're more likely to be able to get back to work first. So that's what I'm working on with my fellow governors. And we also are going to be thinking about what are the communities that we target when we think about this testing. The obvious one, of course, is our first responders, starting with our nurses and docs. God bless you. Making sure you're safe, maybe making sure that you can get to work and stay at work and know that you're COVID-free. I think also about our most vulnerable populations. We've talked a lot about our folks in the nursing homes and do a better job of testing there. And Josh will be able to answer questions further about what we're doing and making sure you're quarantined in those nursing homes. And also we're opening up COVID-only nursing homes. And that would be a second priority for our testing. And I also think a lot about our big manufacturing facilities. A little distress that Electric Boat has had a fair number of infections over the last few days. Good news is that Kevin Rainey, the president, is now free and clear because he had been infected as well. What they're doing in terms of separating out the different shifts, they got the blue shift and the gold shift, I think it is, with a break in between so they can clean everything down. They're ramping up in the thermometers, ramping up in the testing. Those are areas, again, where I want to focus our testing. And that's what I'm collaborating with my fellow governors, but more importantly, what we're doing ourselves. And there I'd like to just take a minute to announce that we're going to have a Reopen Connecticut Advisory Board. And this is made up of the best and the brightest around the state, business as well as science. One familiar name is going to be co-chairperson of that board, that's Indra Nui. Indra, as you know, is also helping take the lead in our economic development efforts. And CT Advantage and what that means. Her co-pilot is Dr. Albert Coe. He's our Dr. Fauci, so to speak. He is Yale's leading epidemiologist and infectious disease specialist. And they were going to put together a collection of folks from business and science with a focus on health outcomes, analytics, clinical lab work, mobile technology. So we have exactly in place what we need when we think about the molecular testing, the antibody testing, the broad-based testing. What are our priorities as we try and think about getting people back to work safely sooner rather than later? And those are all the protocols, that's all the data that we're going to be sharing on a regional basis with my fellow governors, and more importantly, or just as importantly, sharing on a national basis. We talked to Dr. Birx about that just this morning, and she's really urging other states to follow the lead of the Northeast states to do a better job of making sure that information comes to them. We're going to be announcing the rest of the advisory board over the next couple of days. I can tell you that we have Connecticut's very own Scott Gottlieb as a senior advisor to this group. Scott, you probably remember, was recently head of the FDA, Food and Drug Administration, in the Trump administration. And also Zeke Emanuel, who maybe you know is a healthcare expert, currently a University of Pennsylvania professor, and before that, healthcare in the Obama administration. I'll just tell you a few other things that I'm thinking about right now is our protective gear. I've got some good news. Right now, the ventilator situation seems to be opening up. The feds are getting a lot of ventilators. We're receiving some ventilators. And I have right now a high degree of confidence that if we keep to our social distancing, nobody's going to be denied a ventilator who needs it. And that's extraordinarily good news. We were able to distribute our N95 masks. We got a couple 100,000 out to about 70 of our municipalities. They in turn get out to the nursing homes. They get out to other first responders as well as hospitals. And I like to think that for the near term, meaning the next week or so, we ought to be able to manage our need for masks, N95 masks and the such. But I'm tired of just complaining about getting product from the Chinese, complaining about getting product from the national stockpile. I've said before, I think increasingly we're going to be on our own, and we ought to figure out what we're going to do. And with that, I can tell you that our administration worked closely communicating with Battelle, which has the only FDA-approved sanitizing, recycling equipment out there. We're going to be one of the very first states in the country installed this week the Battelle sanitizer. What that means is we'll be able to take up to 80 or 90,000 N95 and other face masks on a daily basis, get them sanitized, FDA approved, and back available to people. And that's important for our first responders, that's important for manufacturing, and over time we've got hundreds of thousands of additional masks that are scheduled to come any day. You've heard that from me before. So we'll be able to expand the orbit of people who are able to get back to work because they'll have the necessary facial protection. Obviously, grocers and food service workers near the top of that list, and other small business once we have that supply and we can count upon it. I'll just leave you with one story because this meant a lot to me. This is, I think, relatively good news. And I've heard this from our fellow governors as well. And this is true in Louisiana. This is true in Detroit. This is true in New Jersey and New York and Connecticut and Massachusetts. We hope the curve is not bending down. We have a way to go there, but we hope we can manage in terms of capacity what we need to do. That's in small part because we're getting more of the PPE that you need. It's also in large part because you're maintaining your discipline when it comes to the social distancing. And I know there's a lot of anxiety and maybe we can rush back and stop shutting us down and it's soon going to be spring. And I just wanted to give you highlights of a great story. I still read the sports pages, although there's not much new in the sports pages these days. But there was this Sunday in the Hartford Courant, and it's an article called No Staying at Home, the opposite of stay safe, stay at home. And it's a story about the Spanish flu when it came to Connecticut in 1918. And the headline on September 21st, 1918 said, "The Spanish grip," that's what they called the Spanish flu, "has spread over the city. Estimated there are 500 cases that now are being treated in Hartford." 500 cases. They were warning people to be careful. But that very same day on the sports page of the Hartford Courant, it said, "Babe Ruth in Sunday game in Hartford." And they had already won the World Series. Babe Ruth was then with the Boston Red Sox, and they were doing a sort of an all-star cast. And they came back, and a few days later, 5,000 fans showed up at the Hartford baseball grounds, and they're all taking the trolleys there and cheering their hearts out for Babe Ruth in this game. And as you can imagine, the stay safe, stay at home mantra failed in Hartford. And they went from having 500 people that looked like they were afflicted to 5,000 flu-related deaths in the greater Hartford area and 9,000 deaths in Connecticut over the course of the next 12 months. 9,000 deaths. That's 1% of the Connecticut population. 1% of the Connecticut population today is 30,000. 30,000. That's not going to happen. We're not going to let that happen. But I know the temptation for the next Babe Ruth, the next fun thing that's coming on, the next sunny day, everybody's going to want to get out and let it rip. And I just got to urge you any way I can. On a rainy day, this is easy. And I know your temptation to get the businesses going as soon as we can. I guarantee you, I know more than in my heart, we're going to do everything we can to get these businesses open. We're planning about that every day. But in the meantime, I've got to urge you, I've got to remind you, I've got to tell you, maintain the social distancing. That's how we'll be safe, and that's how we'll get this economy going again. With that, Max, I'll see if there are any questions that either Josh or I can try and answer.
We'll go first to CT News Junkie.
Okay, can you hear me?
Hi, Christine.
Hi, thanks for taking my question. I wanted to know what role the legislature plays in your thinking about reopening the government. I know that you have, the economy. I know that you have the group that you've appointed today, but what role should the legislature play?
A very collaborative role. I talk to the legislative leaders with some frequency. Paul Mounds, our chief of staff, talks to legislative leaders all the time. I know some of them feel a great urgency to hurry up and get this economy going, hurry up and let me just get my stores going, relax the social distancing. I'm talking to them every day, but I think you can tell from my message, this is going to take a little bit longer, and it's going to take some discipline.
Well, and what necessarily are you doing? I know that we have this storm today and we have a lot of power outages, and I know it isn't hurricane season yet, but hurricane season starts in June. And what happens if somebody can't shelter in their home?
Look, that's a very good question. First of all, I'd ask everybody's neighbor to look out for their neighbors. If you know you have somebody, an elder neighbor who's probably in a home and you know should not be able to leave, look out for them. And probably their landline phone is working, even if their power is out. At least give them a call and check in on them, absolutely. You know, more than that, Josh, any other recommendations?
No, I think as we get to hurricane season, Christine will probably have some additional thoughts on that.
Move on next to Channel 3 Eyewitness News.
Yes, Governor, just wanted to see, what the criteria is going to be when we reopen the state. Are we going to be doing this county by county like you see in Tolland County and Windham counties? There's really not that many cases. So what's the criteria that you're going to be looking for when you decide to open up some of those counties?
Yeah, that's why I've got this advisory group made up of business leaders and scientific leaders. I do tend to think we're a relatively small state, so maybe you say, hey, open up Tolland, keep Fairfield County closed for a while longer, look at the infection rates, and also look where the trends are going. And, if everything's opened up in one county, closed in another, you may, incent people to travel back and forth across the state to buy things or go to a restaurant. And none of that is any good for what we're trying to accomplish. My number one criteria is A, make sure I have the hospital capacity so I can get people back out safely without risking our hospital capacity, and looking very closely at the infection rates as we build out our testing. And I think if we do that on a consistent basis, we're in a strong position to make some real determinations within a month.
The day of New London.
And then,
Oh, sorry, Matt, go ahead.
yeah, just in terms of the nursing home plan, has that started yet? Have we seen some of these exclusive coronavirus patient homes established yet?
Yeah, so the first couple are being opened up this week, and preparations and negotiations are underway to open up a number of additional ones.
But Matt, it is my understanding that while we're opening up the COVID only in the separate facilities, in the meantime, within every nursing home, everybody who should be quarantined is quarantined.
The day of New London. Move along next to Fox 61.
Hi, Governor. You talked about identifying best practices for different counties, such as antibody testing down in Fairfield and molecular testing in areas such as Tallinn and New London counties. So what is your response to the letter Senator Fasano sent you today in regards to before making promises to the governors of New York or New Jersey, he wants you to consult with Connecticut lawmakers and his warning against a one-size-fits-all approach?
Well, there's obviously, as I just showed you, there's no one-size-fits all even within the state of Connecticut. And I'm going to rely upon the experts because, frankly, I'm a sociology major. But I do see that when I want to test for infections, probably that makes more sense in those areas that are less infected, because then I can quarantine those people and make sure the infection rate slows down in eastern Connecticut. And when I want to test for people who have already been infected, maybe or in a better position to get back to work, that makes sense in those areas that have had a higher infection rate, like a Fairfield County. And I got to tell you that in New York, for example, they have some areas, everybody there is generally higher infection rates than we do, so they'll have a sort of a different set of criterion. What's important, though, is that we share the data and we share what our protocols are, and we work together in terms of our social distancing mandates going forward.
Well,
And during the 2 p.m. call, Governor Cuomo invited other states to join this task force. How do you feel about nearby Massachusetts not being a part of this conversation? Or is it not as much as a concern since the highest amount of COVID-19 cases is in the southern part of our state?
No, I very much wanted Charlie Baker to be part of this. I'll give him a call. I didn't have a chance to talk to him about it today. He's definitely invited. We definitely want him there. We share a big border with Massachusetts. It's important we collaborate.
move along next to the day of New London.
Hi, Governor. I wanted to ask in connection with these PPE distribution centers that are just opening this week, I guess, around the state. Is that the material that's coming in from the federal government? Is that where it's being distributed from?
Why don't you take that?
Yeah, so those distribution centers are all PPE. So we haven't been receiving any additional PPE distributions from the federal government, I think, in a couple of weeks now. So those are the regional distribution points for all the PPE that we're acquiring directly in the state, as well as donations and other sources of PPE. So it's all of our inventory has been consolidated to make the delivery process as efficient as possible.
Thank you.
And I was just notified that Massachusetts has just joined the partnership, so that's good.
We'll move along to Hearst, Connecticut Media.
Hi, Governor.
Hello.
So Hearst today reported that the decline in the prison population is due to fewer people entering the facilities, not more people being released. Groups like the ACLU and families of incarcerated inmates have asked you to consider releasing people at a higher rate. Are you reconsidering that at this point, or do you still intend to just keep things the way they are?
Well, remember, keeping things the way they are means we're releasing Nonviolent, those are considered low-risk people at a faster rate than we have in a long time. We do have the lowest number of people incarcerated as we've had. I did read the article, though. It also pointed out that those were scheduled to go to prison for minor violations. I don't know if you call a parole violation minor, but it probably is nonviolent related. Those people are not going into the prison. My number one criterion is public health. We're opening up wings of the correctional facilities, making sure that those older prisoners who probably, if we find there's not a safe place for them to be outside of the correctional facility, if we find that the safest place for them to be is in the facility under close medical attention, that's where they'll be. But we're not resting on the status quo. We're continuing to have, move people where they can be most healthy and safest.
Thanks, Governor. And also, I just noticed you said Charlie Baker's joined the group. It was 6 Democratic governors who made the announcement today, so I guess that makes it bipartisan. But I'm concerned that some of the things that the president was saying about he's the decider who reopens. Governor Cuomo went into that pretty extensively after your 2 o'clock with the New York media. How concerned are you that the president's trying to muscle into state and regional issues?
Well, actually, we wanted him to get more involved when it came to buying ventilators in China and buying PPE and getting that appropriately distributed. Thought that was better for the federal government to do than 50 states and a number of territories. But I think he's been generally clear, and just as importantly, his COVID task force is always asking the governors what their priorities are, how we're thinking about getting things reopened. So I don't really think they're going to try and mandate a one-size-fits-all, as it was referred to previously, for all 50 states. We're in very different situations, and we're all going to address the slow reopening of our states in a thoughtful way, each state being a little bit different.
And finally, Governor, thanks. Your trio with Ms. Newey and the Commissioner Coleman Mitchell and Paul Mounds, is that like a co-equal 3 people? How are they going to relate to the larger group?
Well, it's Indra Newey, who's broadly there representing the business community. Lots of feedback from small as well as large business all over the state. Let them know what our thinking is as we move towards reopening different facets of the economy. It was Albert Koh. He's the epidemiologist from Yale. He represents probably the interest, and he's putting together our scientific portfolio of experts who's going to be on there as well. And Paul Mounds, our chief of staff, is going to work with Josh. Paul works with the other governors. Josh is working with the legislative leaders, as I understand it, so we can make sure that everything we do is coordinated and we're working together.
We'll move on next to the Associated Press.
Yes, Governor, could you address the nursing home thing in a little more detail? Is this happening just for patients being released from the hospitals, or are patients being moved now from nursing homes to these COVID-only homes? And is that a voluntary thing if that is happening?
Well, let me start, and then Josh can fill in the blanks. I just got off with the Vice President's task force and probably 40 other governors, and I got to say nursing homes was half the conversation, just because sadly nursing homes are a pandemic of their own and represent 25% of the fatalities and even hospitalizations in many of these states around the country right now. We're all moving in the sense that we fortunately have more extra capacity than some of the other governors, some of the other states. So we are able to get people quarantined within their existing nursing home, which is advantageous because they can stay, closer to home, at least closer to the nursing home where they've always been. I was intrigued talking to some of the other governors about how they're setting up FaceTime and Zoom and helping their parents or grandparents in the nursing home better use the technology so they can communicate going forward. And Josh, you want to talk about the new homes?
Yeah, so the recovery centers that we're standing up, as you point out, will be primarily a location for patients that are being discharged from our acute care hospitals who are don't need that level of care any longer, but are not yet either completely recovered or ready to go back to where they had come from. And so that'll be an opportunity to help decompress our hospitals and free up capacity in the hospitals for some of those types of residents and patients. There will also be opportunities, if necessary, to transfer patients into those recovery centers. But as the governor said earlier, the vast majority of people who get COVID-19 in a nursing home will be taken care of where they are, either in a separate wing of that nursing home or under, the strict infection control procedures that each nursing home will or does have in place already. So we don't anticipate many, if any, involuntary moves, but we're working with all of our nursing homes to ensure they each have the appropriate precautions in place.
Thanks. So a follow-up on beds. Can you update us on the capacity in hospitals for COVID? We've seen a lot of National Guard activity putting up these beds. Are any of these being used at this point? How many beds do you anticipate now that we'll need? Is that less than before? And do you anticipate any problems with that? And are any of them being used now?
Sure. So we're now over 1,800 beds of surge capacity outside of our hospitals that have been set up. None of that capacity is in use at this time. It is all there in case we need it. However, even within the four walls of our existing acute care hospitals, we still have, on a statewide basis, about a third of our beds unoccupied, a significant number of ICU beds, a significant number of decompression rooms, so negative pressure rooms. So our hospital system is coping well. Certainly in Lower Fairfield County and some of the hospitals down there, it is quite active still, but the teams are doing a great job. And on a statewide basis, we still have a significant amount of unused hospital bed capacity.
If everyone on the line could please mute their devices. Please mute your devices. Thank you. We'll move along next to Boceto Media.
Hi, this is Marika Hawaringa. I'm also represented at Tribune newspaper today. And Governor Lamont, your administration is talking about slowly reopening the economy and considering that Latinos are the second biggest minority in Connecticut and in a disadvantage for a racial disparity. What has your administration done so far to inform the immigrant community about COVID-19 prevention and resources in their language? Thank you.
That was a question you heard about. In particular, what are we doing for the immigrant community when it comes to COVID-19 and helping them get back and helping them make sure they get the health care they need? Two things. One, we work very closely with our congressional delegation to make sure that nobody, regardless of documentation status, is denied the health care that they need. That is the right thing to do for those people. That's the right thing to do for our community. The other thing that was really important to me was we get the faster test sequencing coming in, more testing available, the 15-minute Abbott lab test, focus on a couple of our cities that are most afflicted to make sure that nobody is left behind in terms of that testing capacity. So Stamford and then New Haven will be our first two up and operating in terms of the 15-minute test, before the end of this week. So I want to make sure that everybody knows that they can be tested safely, and they can get health care if they need it.
Move along next to the Meriden Record Journal.
Hi, can you hear me?
Yes, we can.
Okay, hello, this is Mary Ellen Gordon. I had a question about, first of all, my initial question was about Massachusetts, particularly given the Bay State model is very, very similar to Connecticut's model of peaking at the end of April and the beginning of May. So I was wondering about the coordination with that and was glad to hear that Charlie Baker was on board. Also, I had a question about the numbers in the individual nursing homes. I was wondering when that was going to be released.
I'll take the first one, and Josh can, is our PhD in nursing homes. I just want to say I've got a strong relationship with Governor Baker in Massachusetts and Governor Raimondo. Obviously, we did a lot with Cuomo just early on, given the nature of the pandemic, Southern Connecticut, New York City. Up in the eastern part of the state, electric boat. They're on both sides of the border, Rhode Island in Eastern Connecticut, New London. So I'm working closely with Gina there. When it comes to Charlie Baker, he comes out of the world of healthcare. So he is one of the people we listen to during the governor's calls. In particular, when I was referring to some of the innovations as regards to nursing homes, we're following closely the Massachusetts model as well. So I'm particularly happy that he is part of our partnership.
Could you just repeat the last part of your question too? You broke up a little bit.
I've been looking through the number of affected patients in the individual nursing homes. I know there was some data released last week. I was wondering when that was going to be updated.
Sure. Well, we'll have in our nightly metrics report our standard nursing home reporting data. What that will show is we're now at almost 50% of our 250 nursing homes. 107 of our nursing homes have at least one confirmed COVID infection. So, remember Dr. Carter probably a month and a half or 2 months ago reminded us that in a normal year, the standard flu, influenza, will have an outbreak in about half of our nursing homes each year. And we don't typically talk about it, but that's the nature of the challenge with this very at-risk population. And so we're there now with COVID-19, and we're obviously taking all the actions and working very closely with our nursing home partners to try to contain those infections as much as possible.
Move along next to the Waterbury Republican American.
Thanks. I noticed we're not seeing a statistic on hospital discharges. Why not? Is that going to be a regular or a periodically reported statistic?
Yeah, I think we reported that on Thursday or Friday. I mean, we can include that more often if that's helpful. We're capturing that data every day. I don't think you're going to see a significant change in the trend line kind of day to day, but we can share that data as needed, Paul.
And what about I thought there was going to start to be reporting on the number of positive tests, hospitalizations, and deaths per nursing home. I thought that was going to be part of the daily updates too. When can we expect to see that information presented on a daily basis?
Yes, we're working on that. We had hoped to have that in the package for today. There's still some more scrubbing that needs to be done. It's obviously very sensitive data. We want to make sure we get it perfectly accurate before we release it, and hopefully that's coming out tomorrow.
Move on next. Oh, sorry. Go ahead, Paul.
Well, what sort of legal advice have you gotten, Governor, regarding interstate cooperation and coordination? Obviously, there's been some concern expressed earlier, particularly from some Republican legislative leaders, about what you're doing and whether or not you might be going too far.
First of all, every state, makes its own decisions. That said, I think we're much better off when I use information, share information with my fellow governors. I think we're much better off when we all bring our best experts to the table so they can share information as well. I've got, several different borders, New York, Massachusetts, Rhode Island. Each and every one of those situations is a little bit different. Obviously, we're collaborating closely, not just with the scientific community and the business community and labor, by the way, because they've got concerns about their folks and making sure they have the protection they need when they go to work every day. And of course, as I said before, we do everything in collaboration, with our legislative team. I got to have the state continuing to work together. I know it's getting very tempting, and spring is coming, and maybe we've been a little too strict on social distancing. Let's let up. And I do worry about that. I look at the examples overseas. I see what's happening there. I listen to Dr. Fauci, who warns us every day about the possibility of a second surge, a smaller surge, but a second surge. I think about 1918, as I was just reading before, about how more people died in the second wave of the pandemic than in the first wave. So I think nothing would be tougher on the economic confidence than if we ended up with a false start. And I want to make sure what we do it right. And I also want to make sure that, we're talking about opening up the economy in a very thoughtful way over the next, 2, 3, 4 months, whatever that category may be, based on the facts of the ground, just because we are going to get back to normal, and we got to have hope we're going to do it, and you got to know that we're going to do it right.
Move on to News 8, Bob Wilson.
Governor, to move on and do it right, you've mentioned testing over and over again. Where do we stand with molecular testing, antibody testing, broad-based testing? I know we talked to St. Francis Hospital, Trinity Healthcare last week. They're having long lines. They just got approved to do their own lab. Where are we in testing, and how, as Dr. Carter says, we have to find a way to screen the entire state? How do you do that?
I can tell you in the call this morning with Dr. Burks, she was giving us hope that in terms of the ingredients we need, in terms of more testing capacity, adding on increasingly the Abbott Labs test over by the end of this week. We've got a couple of new private labs that are going to ramping up. You'll see a lot more of what you call the molecular testing, which is we can see whether you're infected or not. I think we're supposed to get a green light from the federal government later this week in terms of those labs, those companies that are certified for the antibody testing. That's the testing that determines whether you have been infected in the past. And let's face it, we've only tested, 10, 20, 30% of the people who have been infected. And especially in areas of the state like Southern Connecticut, that'll give us a much better indicator of who is safe to get back to work first.
Move on.
How are we doing on swabs and materials? And then I had a follow-up about caseworkers.
Okay, swabs and materials, I can tell you they gave us indication today. We're going to find out very soon about Q-tips or things like Q-tips with saline solution, which would obviously greatly augment our ability to do those molecular tests, the nose swab and the such. And I think we're going to get the green light on that within a few days.
All right, and finally, in Massachusetts, you were talking with them last week about 1,000 caseworkers to kind of track the virus so that afterwards, if somebody's infected, you can go back and quarantine the rest of the people. What is Connecticut doing? Are you going to have these so-called virus trackers?
We're certainly thinking about that. That's something that our advisory group's going to be looking at. You can do that with human capital. As you said, Massachusetts is trying to hire 1,000 monitors to go out and track those people who were found to be infected, see if we can trace back, see who else they may have been contacted with. They're also looking at a number of the social media companies. You probably saw that Apple and Google are putting together a platform, a search engine that would hopefully accomplish some of the same electronically. We got to get on that pretty fast, Bob.
Move on next to the Connecticut Mirror.
Hi, Governor. I'd like to follow up on the testing question. To what extent will the state be relying on the availability of antibody testing to make the decision on easing restrictions?
I think the antibody testing, we are going to have the chairman of our advisory board online, very soon as they get their ducks in order and get all the rest of the staff appointed. And they'd be probably the best people to ask. But to your specific question, we're going to be looking at the antibody testing in terms of the percentage of people in those infected areas that have developed the antibodies. If that's a significant percentage of the people that can get back to work, that will ramp things up on a faster basis. Probably the most vulnerable, the elderly, those with pre-existing conditions, will have to be self-quarantined or isolated a lot longer. And again, the molecular testing, are you infected or not, would probably be more used in the other parts of the states for reasons I described before.
Well, the Governor, one of the reasons I asked that question is trying to get a sense of the extent to which Connecticut will be relying on something that isn't exactly available right now. What is your latest information about how soon that test will be available, how widespread that test will be available?
I think you're going to see it widely available as soon as this week. We have done hundreds of antibody tests already in this state. So it's right now we're looking for the final FDA approvals and those which the federal government lead us towards in terms of a more broad-based testing. And I think it will be very broad-based.
Okay, just one quick thing I wanted to clarify. Albert Coe and Indra Nooyi, are they both running the Connecticut recovery group as well as serving as Connecticut's representatives with Paul Mounds to the regional one?
Yes.
Thank you, sir.
Move on to the Hartford Courant.
Governor, hello. Also on the testing issue, you had mentioned a company in Stamford called Semaphore, I believe, and they were going to greatly increase the testing capacity, processing up to 6,000 tests a week. But lately we're told they're only doing 50 to 100 a day because they don't have enough samples. Are you concerned at all that the issue is one of sample collection and not processing?
You got it, Jeff.
Yeah, you're right, Chris. And we're talking to them every day, trying to work with our procurement team to source additional sample collection kits. But you're right that is the limiting factor as they get ramped up right now, and they're in discussions with a number of hospitals around the state who may have access to additional sample collection kits. And then some of the new technologies, the new sample collection approaches the governor just alluded to, can potentially help. They're also working on some creative sourcing ideas about how to get some of their own sample collection kits. So we're attacking that from a number of different angles to help them get ramped up, and they're eager to do so.
And also, Governor, I just have one question on how quickly do you expect your task force to move? In other words, I would assume Governor Cuomo had mentioned a matter of weeks. Well, what kind of a time frame? Not particularly the time frame of when everything would be reopened, but how quickly your task force will have recommendations.
Oh, I want an action plan, and I want an action plan as soon as I can. Let's say how we can do some preliminary testing within a few weeks. I think it's time for us to get this show on the road. I don't want an academic analytical exercise. I want an action plan to go forward. And they've got best practices from other states. At least they can compare notes with experts, so we know we can fact check what we're trying to do. But I think it's a time for us to get going on this, and testing is going to be a big part of helping our decision making about opening up the economy.
Move on to WTIC 1080 Radio.
Good afternoon.
Hello.
Can you hear me? Hey. I guess it's group of 7 now, after it was group of 6 earlier today, now that Massachusetts is on. Is this a response to the federal government pretty much with a statement this morning claiming more power over this and power over the states?
Look, I spend most of my time with the COVID task force led by Vice President Pence, and as I mentioned, Birx and Fauci, and that's the team that I really do my interface with. They welcome the fact that the Northeast states are taking the lead on this collaborative process. They urged other states in the country, and they're beginning to do this already, to think in terms of a collaborative effort as well. And they're going to be putting together their own national group to help at least give our states guidelines in terms of testing and other protocols so we can better consolidate what we're trying to do.
Does the group of 7 have a better name than the group of 7 yet?
That's we'll take ideas. Send me your ideas.
You got it.
I think with that, everybody, thank you very much, and I hope you had a good, brief holiday season with your family.